All right, you guys, well, Thursday is Chronic Disease Day, and they're shedding light on people who are suffering from it. And here to share more is Dr. Lela from the Functional Medicine MD. Welcome to the show.
Thank you, Amber. Happy to be here.
Well, thank you so much for everything that you share. It's so important. And talk to me about chronic disease.
So, you know, I like numbers. So chronic disease, 60% of Americans have at least one chronic disease. And 70% of Americans take at least one prescription drug.
Wow.
And 1 out of 4 take 5 or more prescription drugs. And U.S. spends $5 trillion, T with a trillion, T, on healthcare.
Wow.
And yet, we are number 30 among the developed nations in health.
Wow.
So we're doing something is amiss, right? We're spending all this money and people are not healthy. So we need to look at it. And tomorrow's Chronic Disease Day, so let's put some attention to it.
Yeah, let's get into it. And I know chronic disease, everyone kind of assumes they're going to have one the older they get.
Right, but that's not true. But even if you look at the list of chronic disease, so it's anything. It could be diabetes, high blood pressure, heart disease, strokes, Alzheimer, cancer, autoimmune diseases, anything is a chronic disease. But the fun part is, yeah, we don't have to, we have this dogma, right? You get old, you get sick, and then you die.
Right.
But it doesn't have to be that way. We can be living healthy. And when it's time to go, then it's time to go. We don't have to be sick to go.
Absolutely. I know Alzheimer's runs in my family, and so I'm always doing different things to, I feel like, prevent it. You know, you're always constantly thinking about it. So how do you prevent chronic disease coming into your life?
Yeah, so there is, you know, before somebody presents to you, the thing has been going on in the background for maybe even years. Like, okay, so what's the first sign of a stroke? It's a stroke.
Yeah. Slurred speech?
Yeah, or the slurred speech, weakness in the arm, but you're actually having a stroke, and that's the first symptom, right?
Yeah,
so that's when somebody would come to you, or even a heart attack. What's the first sign of heart attack? Well, it's heart attack. They're having chest pain, and then they're having a heart attack. But so in traditional medicine, like when I was training or when I was in med school, we were taught, don't go looking for things that the person is not complaining of.
Interesting.
And don't do testing that it's not pertinent to that thing that they're doing. Or, you know, put everything in a nice bundle, give it one diagnosis, so then we can attach one pill to it and make a nice package. But why are we waiting for that?
Right,
why aren't we doing testing way before?
Absolutely. And I cannot wait when we return to talk about that kind of testing, what you can do to prepare yourself and prevent chronic disease, which she does very well. Well, Thursday is Chronic Disease Day, and we're continuing the conversation on how you can prevent chronic disease in your life. And Dr. Lela is sharing more. So we're talking about treatments or prevention.
Yes, early diagnosis would be the key. So, you know, by the time somebody finds out that they're diabetic, they're sick for a long time.
Absolutely.
But we can do like an insulin test. It's a blood test. And these tests are not very expensive, Amber. They're easy to do. But if we find the insulin level is high, we can say, okay, you have insulin resistance. And here is what you do in terms of lifestyle or diet changes. And we can even prevent them ever becoming a diabetic, because once you're diabetic, then you start the cascade of high blood pressure, heart disease, kidney disease, Alzheimer's. So if we can do things like that early, or even, you know, if we can get an inflammation marker early in the game, it's called CRP. If we see that there's a slight inflammation, we can go digging for it and see what's causing that and prevent it ever turning into anything significant. Another test is autoimmune marker. It's called ANA. And if it's slightly elevated, it for sure, it's not going to go away on its own. For sure, over the years, it will turn into an autoimmune disease. And wouldn't you rather know that now than 10 years down the line, oh, you have rheumatoid arthritis, you can't move your hands, you can't kneel down with your kids, you can't go hiking, you can't live your life like you want to.
Absolutely.
So it's so easy. It really, you know, I'm not saying that people should come to me, but go ask your doctor to run these tests on you, and you might have to ask them a couple times, because this is not how we do things in traditional medicine. And nothing against that, but that's how we were taught, is don't look for things. But I think it's better to look and prevent it than to go and be on 4 or 5 different prescriptions for it.
Absolutely. Being an advocate for yourself in that space is so huge.
Yes.
What can people do at home to even prevent chronic disease?
Don't ignore your symptoms. You don't know how many people, including myself, live on Tylenol, ibuprofen, Pepcid, Zyrtec. Like this is, and they think this is normal. Like having joint pains is normal or having allergies is normal. No, it's not. Your immune system is off. That's why you have allergies.
Really?
Your immune system is off. That's why you have pain. Pain is a symptom of inflammation. So don't just put a Band-Aid on it with Tylenol and ibuprofen. Nothing against those drugs, but find out why. Where is the inflammation coming from?
Absolutely, yeah. I had a friend who did actually yesterday learn this. She did some blood work before this really stressful situation she was going through, and then after, and her levels were just spiked, and she had to go really deep within to figure out what was wrong in that process now of like, okay, let's prevent this from happening. How can functional medicine help in that process of preventing chronic disease?
We start with where it's coming from, and one of the most common places is the gut. This is embarrassing, but I didn't know up until I was an adult that what is a normal bowel movement.
Nobody ever tells you.
You think it's normal to be bloated. It's normal to have a little bit of reflux. That it's okay to not have a bowel movement every day, or even if you do, what should it look like? Or is it okay to have loose? Those are not normal.
That's so interesting.
It is not normal. So if you have any symptoms, find out what's going on, and we can do testing again to see if you're eating foods that you're sensitive to, and then we can take those out and we can heal the lining of the gut and get that inflammation taken care of.
See, that's something I would have never have thought of. It's normal. Oh no, I had too much coffee, or we never know what it might be.
I know, that's the problem. We just ignore the symptoms.
Absolutely. Where can people find you online and get in touch with you and all you do?
Yes, they can go to our website. I have a free 15-minute consult. They can choose their time and date that works best for them, and I love to speak to them.
Well, you are the best. Thank you so much for dropping all this knowledge and just being so open and honest. You're so wonderful. And we'll see you in 2 weeks.
In 2 weeks,
All
we'll
right.
continue.
All right, we'll see you later.